1. A patient with type 1 diabetes reports feeling shaky and sweaty. Their blood glucose level is 45 milligrams per deciliter. What is the nurse's priority action? Answer. Administer 15 grams of fast-acting carbohydrates, such as 4 ounces of orange juice. Rationale: hypoglycemia, blood glucose, less than 70 milligrams per deciliter, requires immediate administration of 15 to 20 grams of fast-acting carbohydrates to raise blood glucose levels. Symptoms like shakiness and sweating indicate the need for prompt intervention to prevent complications like seizures. 2. A nurse is preparing to administer insulin Lispro, Humalog, to a patient with type 2 diabetes. When should this medication be given? Answer: within 15 minutes before or immediately after a meal. Rationale: Lispro is a rapid-acting insulin that begins working within 15 minutes. Administering it close to mealtime prevents postprandial hyperglycemia, while minimizing the risk of hypoglycemia before eating. 3. A patient with diabetic ketoacidosis, DKA, has a blood glucose level of 450 milligrams per deciliter and a serum potassium of 5.5 milliequivalent/L. What should the nurse monitor for during insulin therapy? Answer: hypokalemia. Rationale: insulin therapy for DKA drives potassium into cells, potentially causing hypokalemia. Monitoring potassium levels is critical to prevent arrhythmias or other complications. 4. A patient with type 2 diabetes asks why they need to inspect their feet daily. What is the nurse's best response? Answer: to check for cuts or sores that could lead to infections. Rationale: diabetes can cause neuropathy and poor wound healing, increasing the risk of foot infections. Daily inspection helps detect issues early to prevent complications like ulcers or amputations. 5. A nurse is teaching a patient with type 1 diabetes about managing hyperglycemia. Which symptom should the patient report immediately? Answer: fruity breath odor. Rationale: fruity breath is a sign of diabetic ketoacidosis, DKA, a life-threatening complication of hyperglycemia. Immediate reporting ensures timely intervention to prevent severe outcomes. 6. A patient is prescribed metformin for type 2 diabetes. What instructions should the nurse include? Answer: take the medication with meals. Rationale: taking metformin with meals reduces gastrointestinal side effects like nausea and diarrhea, improving adherence and effectiveness in controlling blood glucose. 7. A patient with diabetes presents with a blood glucose level of 350 milligrams per deciliter, lethargy, and confusion. What is the nurse's priority action? Answer: administer 4 fluids and insulin as ordered. Rationale: these symptoms suggest hyperglycemic hyperosmolar state, HHS, or DKA. For fluids and insulin correct hyperglycemia and dehydration, stabilizing the patient's condition. 8. A nurse is educating a patient with diabetes about exercise. What precautions should the patient take to prevent hypoglycemia? Answer: check blood glucose before exercising and carry a carbohydrate snack. Rationale: exercise can lower blood glucose levels, risking hypoglycemia. Monitoring levels and having a snack available ensures safety during physical activity. 9. A patient with a diabetic foot ulcer is instructed on wound care. What indicates the need for immediate medical attention? Answer: redness, swelling, or foul odor from the wound. Rationale: these signs suggest infection, which can rapidly worsen in diabetic patients due to impaired immune response and poor healing, requiring urgent intervention. 10. A nurse is assessing a patient on insulin glargine, Lantus. What should the nurse clarify with the patient about this medication? Answer: it should not be mixed with other insulins in the same syringe. Rationale: glargine is a long-acting insulin with a unique pH that can precipitate if mixed with other insulins, reducing its effectiveness and causing unpredictable glucose control. 11. A patient with type 2 diabetes is prescribed glipizide. What should the nurse teach the patient about this medication? Answer: take it 30 minutes before breakfast. Rationale: glipizide, a sulfonylurea, stimulates insulin release and is most effective when taken before meals to control postprandial glucose levels. 12. A patient with a blood glucose of 60 milligrams per deciliter is alert. What should the nurse administer? Answer: 15 grams of fast-acting carbohydrates. Rationale: for mild hypoglycemia in an alert patient, 15 grams of fast-acting carbohydrates, like juice, raises glucose safely. Recheck glucose after 15 minutes. 13. A nurse observes a patient injecting insulin into scar tissue. What should the nurse teach the patient? Answer: rotate injection sites to avoid lipohypertrophy. Rationale: injecting into scar tissue, lipohypertrophy, impairs insulin absorption, leading to poor glucose control. Rotation ensures consistent absorption. 14. A patient with diabetic neuropathy reports numbness in their feet. What is the nurse's priority teaching? Answer: inspect feet daily and wear protective shoes. Rationale: neuropathy reduces sensation, increasing injury risk. Daily inspection and proper footwear prevent unnoticed wounds and complications. 15. A patient with type 1 diabetes has a blood glucose of 300 milligrams per deciliter and ketones in their urine. What is the nurse's priority action? Answer: notify the healthcare provider and prepare to administer insulin. Rationale: high glucose and ketones indicate diabetic ketoacidosis, DKA. Prompt insulin therapy and provider notification are critical to correct acidosis. 16. A nurse is caring for a patient receiving insulin for hyperglycemia. What should the nurse monitor closely? Answer: blood glucose and potassium levels. Rationale: for insulin lowers glucose and drives potassium into cells, risking hypokalemia and hypoglycemia. Close monitoring ensures patient safety. 17. A patient asks why they need to monitor blood glucose at home. What is the nurse's best response? Answer: to adjust treatment and prevent complications. Rationale: home monitoring helps patients track glucose trends, enabling timely adjustments to diet, exercise, or medication to avoid hypo or hyperglycemia. 18. A patient with diabetes develops a small blister on their heel. What should the nurse advise? Answer: keep the area clean and avoid popping the blister. Rationale: popping blisters increases infection risk, especially in diabetes. Keeping the area clean promotes healing and prevents complications. 19. A patient with type 2 diabetes is started on insulin detamir, levemir. When should the nurse expect its peak effect? Answer: it has no pronounced peak. Rationale: detamir is a long-acting insulin with a steady effect over 24 hours, reducing the risk of hypoglycemia compared to peak-acting insulins. 20. A nurse is teaching a patient about managing hypoglycemia. What should the patient do after consuming 15 grams of carbohydrates? Answer: recheck blood glucose in 15 minutes. Rationale: the 15 to 15 rule requires rechecking glucose after 15 minutes to ensure it rises above 70 milligrams per deciliter, guiding further treatment if needed. 21. A patient with diabetes reports frequent nighttime hypoglycemia. What should the nurse suggest? Answer: eat a bedtime snack with protein and complex carbohydrates. Rationale: a balanced snack stabilizes overnight glucose levels, preventing hypoglycemia by providing a slow-release energy source. 22. A nurse is preparing to administer NPH insulin. What should the nurse do before drawing up the dose? Answer: gently roll the vial to mix the insulin. Rationale: NPH is a cloudy insulin requiring mixing to ensure uniform suspension, preventing inaccurate dosing and poor glucose control. 23. A patient with type 1 diabetes is confused and has a blood glucose of 650 milligrams per deciliter. What is the nurse's priority? Answer: administer 4 fluids and insulin as ordered. Rationale: confusion and extreme hyperglycemia suggest DKA or HHS. 4 fluids and insulin address dehydration and high glucose to stabilize the patient. 24. A patient with diabetes asks about alcohol consumption. What should the nurse advise? Answer: drink in moderation and with food. Rationale: alcohol can cause hypoglycemia, especially if taken without food. Moderation and pairing with meals reduce this risk. 25. A nurse notices a patient's insulin pen is cloudy. What should the nurse clarify? Answer: whether it is NPH insulin or another type. Rationale: only NPH insulin pens are cloudy. Other insulins, e.g., glargine, are clear, and using the wrong type affects glucose control. 26. A patient with diabetic retinopathy asks about vision care. What should the nurse recommend? Answer: schedule regular eye exams with an ophthalmologist. Rationale: retinopathy can progress without symptoms. Regular exams detect changes early, preventing vision loss. 27. A patient with type 2 diabetes has a blood glucose of 80 milligrams per deciliter before a meal. What should the nurse do? Answer: encourage the patient to eat their meal. Rationale: a glucose of 80 milligrams per deciliter is within normal range, 70 to 130 mg/dl pre-meal. Eating prevents hypoglycemia during activity or fasting. 28. A nurse is teaching a patient about insulin storage. What is the correct instruction? Answer: keep unopened vials in the refrigerator. Rationale: unopened insulin remains stable when refrigerated. Open vials can be kept at room temperature for up to 28 days. 29. A patient with diabetes reports burning pain in their legs at night. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: burning pain is a common symptom of diabetic neuropathy caused by nerve damage from chronic hyperglycemia, requiring assessment and management. 30. A patient with a blood glucose of 55 milligrams per deciliter is unresponsive. What is the nurse's priority action? Answer: administer glucagon intramuscularly. Rationale: an unresponsive hypoglycemic patient cannot swallow carbohydrates. Glucagon raises glucose by releasing stored glycogen, stabilizing the patient. 31. A nurse is educating a patient on diabetic foot care. What should the patient avoid? Answer: soaking feet in hot water. Rationale: hot water can cause burns, especially with neuropathy, and soaking increases infection risk by softening skin. 32. A patient with type 1 diabetes misses a meal after taking insulin aspart. What is the nurse's concern? Answer: risk of hypoglycemia. Rationale: aspart is rapid-acting, lowering glucose quickly. Missing a meal after injection increases hypoglycemia risk due to unopposed insulin action. 33. A patient with diabetes has a blood glucose of 200 milligrams per deciliter 2 hours after eating. What should the nurse do? Answer: document the finding and monitor for trends. Rationale: a postprandial glucose of 200 milligrams per deciliter is elevated but not critical. Monitoring trends guides adjustments to therapy without immediate intervention. 34. A nurse is teaching a patient about sick day management with diabetes. What is a key instruction? Answer: continue insulin and check glucose frequently. Rationale: illness increases glucose levels, requiring insulin continuation and frequent monitoring to prevent DKA or hyperglycemia. 35. A patient with diabetes has dry, cracked skin on their feet. What should the nurse recommend? Answer: apply moisturizer but avoid between toes. Rationale: moisturizer prevents cracking, reducing infection risk. Avoiding between toes prevents fungal growth due to trapped moisture. 36. A nurse is reviewing a patient's insulin regimen. The patient takes insulin glargine at bedtime. What is its primary purpose? Answer: provide basal glucose control. Rationale: glargine is a long-acting insulin that maintains steady glucose levels throughout the day and night, mimicking basal insulin secretion. 37. A patient with type 2 diabetes reports nausea after starting metformin. What should the nurse suggest? Answer: take it with food or ask about extended release. Rationale: taking metformin with food reduces GI upset. Extended release formulations may further minimize side effects, improving tolerance. 38. A patient with diabetes presents with rapid breathing and dehydration. What should the nurse suspect? Answer: diabetic ketoacidosis, DKA. Rationale: rapid breathing, Kussmaul respirations, and dehydration are classic DKA signs, requiring urgent assessment and treatment. 39. A nurse is teaching a patient about carbohydrate counting. What is the goal of this strategy? Answer: match insulin doses to carbohydrate intake. Rationale: carbohydrate counting helps patients with type 1 diabetes calculate bolus insulin doses, improving glucose control and flexibility. 40. A patient with diabetes asks about preventing hypoglycemia during exercise. What should the nurse advise? Answer: check glucose before and after exercise and adjust snacks. Rationale: monitoring glucose guides snack timing and quantity, preventing exercise-induced hypoglycemia by maintaining stable levels. 41. A patient with type 1 diabetes is admitted with a blood glucose of 500 milligrams per deciliter and abdominal pain. What should the nurse prioritize? Answer: assess for diabetic ketoacidosis and notify the provider. Rationale: high glucose and abdominal pain suggest DKA, a medical emergency. Prompt assessment and provider notification ensure timely treatment. 42. A nurse is teaching a patient about insulin aspart novolog. What should the patient know about its onset? Answer: it begins working in 10 to 20 minutes. Rationale: aspart is a rapid-acting insulin, requiring administration just before or after meals to match postprandial glucose spikes. 43. A patient with type 2 diabetes has a blood glucose of 65 milligrams per deciliter and is alert. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia in an alert patient requires 15 grams of fast-acting carbohydrates to raise glucose, followed by rechecking in 15 minutes. 44. A patient with diabetic neuropathy asks why they should avoid tight shoes. What is the nurse's best response? Answer: tight shoes can cause pressure injuries and infections. Rationale: neuropathy reduces sensation, making pressure injuries from tight shoes less noticeable, increasing infection and ulcer risk. 45. A nurse is preparing to administer insulin glargine and regular insulin. How should they be given? Answer: in separate syringes. Rationale: glargine cannot be mixed with other insulins due to its unique pH, which could alter its action and affect glucose control. 46. A patient with diabetes reports blurred vision after a blood glucose of 400 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia affecting the lens. Rationale: high glucose causes lens swelling, leading to temporary blurred vision. Controlling glucose levels typically resolves this symptom. 47. A nurse is educating a patient about metformin. What labs should be monitored regularly? Answer: renal function tests. Rationale: metformin is cleared by the kidneys, and impaired renal function increases the risk of lactic acidosis, requiring regular monitoring. 48. A patient with type 1 diabetes is sweating and irritable with a blood glucose of 50 milligrams per deciliter. What is the nurse's priority? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: symptoms and low glucose confirm hypoglycemia. Fast-acting carbohydrates quickly raise glucose to prevent further deterioration. 49. A patient with a diabetic foot ulcer has increased redness and warmth. What should the nurse do? Answer: notify the healthcare provider immediately. Rationale: redness and warmth suggest infection, which can escalate rapidly in diabetic patients, requiring urgent medical evaluation. 50. A nurse is teaching a patient about insulin storage during travel. What is the correct advice? Answer: keep insulin at room temperature or in a cooler. Rationale: opened insulin is stable at room temperature for 28 days, but should not be exposed to extreme heat or freezing, making a cooler ideal for travel.